cord is the main line, the conduit from our brain to our body. It's actually not that simple. Within the spinal cord, there are actually different circuits. Our spinal cord is more complex than any gadget on Earth. We have circuits for walking. Why do we need circuits? Because remember I told you we do not think about walking. We do not think about which muscles we're going to use. We just walk. Right? We have withdrawal circuits. What's a withdrawal circuits? And I'm not talking about coitus or intercourse, okay? When you say withdrawal circuit, it is when you put your hand on a hot stove, you pull it away. That's the withdrawal circuit. Support against gravity circuits. Yes, it keeps you from falling. It keeps you from becoming limp. Okay? Support against gravity. What supports you against gravity? Your leg muscles and your back muscles. Okay? By the way, your back muscles, review of muscular physiology or anatomy. What type of fiber are your back muscles? Red or white? Red. Okay? Please remember this. The red muscles are responsible for endurance, but they are slow muscles. The white muscles are responsible for speed, but they tire quickly. What is an example of white muscle? White fiber. The eye. Very good. The extraocular muscles, the EOM. That's the reason why if you've been studying for so long, your eyes get tired. Right? Okay. Now we also have circuits for reflex control of organ function. Like, for example, if you are bleeding, what would happen to your heart? You would go into hypovolemic shock. But before that happens, what happens to the heart? Once it senses that the volume is low, what would happen? The heart rate will increase to get more blood pumping into the other organs, especially the brain. Did you have to think about that? No, because if you were stabbed and unconscious, you wouldn't be thinking about that. Your body will be fighting to survive. This is a circuit that enables survival. Okay? For organ functions. So the lower brain level, as I mentioned, okay, contains the medulla, the pons, the mesencephalon, hypothalamus, thalamus, cerebellum, and the basal ganglia. Let's just go over them a bit. Now, what's the medulla? What does it do? Breathing, heartbeat, most of our autonomic functions are in the medulla. Okay? The cardiovascular reflex center, the respiratory center, they're all there. Okay? How about the pons? The pons is the connection of your thalamus to the medulla. Or medulla to your thalamus, sorry, it's the other way around. Okay? It relays signals from the forebrain to your cerebellum. So the pons is more or less a specialized relay center. Okay? It deals primarily with other things, like sleeping. It deals with bladder function. Okay? Bladder function, eye movements, facial expressions. Were we ever taught our facial expressions? No. Right? It was all instinct to us. To smile, to frown. Okay? So, all of that more or less is in the pons. Now, the mesencephalon, the midbrain, is associated as well with things like vision, hearing, sleep-wake arousal, and like the hypothalamus, there's also some temperature regulation functions as well. But the most complex of all is actually the basal ganglia. So the articular thalamus is our relay station. The cerebellum is responsible for fine coordinated movements. Again, cerebellum, please remember this. Fine coordinated movements like dancing, very good. Like playing an instrument. Like riding a motorcycle. Okay? Like driving a car. For those who drive a car, have you ever tried braking with your left foot? What happens to the car? It goes on a sudden stop, right? Why? Because your cerebellum is not trained to use this foot for braking. But race car drivers, those who are trained to run at high speeds, their left foot is trained to do left foot braking. But the ordinary drivers like us are not. The cerebellum is one of the most neuroplastic places of the brain. I urge you actually, during the vacation, to try to learn a new skill, a physical skill, whether it be gardening, something physical. Okay? To develop the cerebellum. Because many students spend all day sitting. This is the only part that's moving sometimes. Okay? And the eyes. So, learn a new skill. The basal ganglia is associated with a whole variety of functions, including all of our voluntary motor control, is in the ganglia. Learning, procedural learning. What's procedural learning? Who here are nurses? Okay. Why only one person admitted they were a nurse? Okay. Probably because someone admitted she was a nurse. The concept of one, in nursing school, do you recall that before you were able to make sheets or to make the beddings of the patient, you actually had to watch the instructor do it. And then you had to do there was a demo and a return demo, right? The return demo, that is a procedure of procedural learning. You learn that making beds is not as easy as it looks. I know, I took up nursing as well, okay? I didn't complete it. It's not as easy as it looks. I was already a doctor when I took up nursing, okay? That's why I have such a high appreciation for nurses. Because if you think that their jobs are so easy, it's actually not. Okay? Beddings alone, it actually get demerited for making a sloppy bedding. Actually got demerited once for making a very sloppy bedding. Okay? That's procedural learning. That is also a function of the basal ganglia. To learn a procedure. But to store a procedure in memory, what's involved? The hippocampus. Very good. Okay? Now, habits. Do you have habits? Mannerisms. I actually have one mannerism and I don't know if you've noticed. We've been together for how many months already? I actually always do this a lot. That's my mannerism. Okay? My mannerism when I sleep, have you heard of bruxism? Bruxism, okay, please know this term. Bruxism is grinding of the teeth. I grind my teeth when I sleep. May I ask how do you know that? Many people who have come and gone in my life have told me that. Their stories are always consistent. That I grind my teeth when I sleep. That's bruxism. All of us have our own mannerisms. Some people, when they're nervous, they bite their nails. All of those habits are in the basal ganglia. The basal ganglia is the one responsible for our habits and behaviors. Okay? Now, remember this. Okay, in a nutshell, the lower brain level controls subconscious body activities more than the medulla, right? Arterial pressure, respiration, equilibrium, feeding reflexes, and emotional patterns. Emotional patterns are always stored. That's the basis for behavior. Please note this. Your stored emotional patterns are the basis for behavior. Personally, I will admit